And we're going to keep this one.
Okay. This is a Miss Simpson. She presented about 4 weeks ago. Severe low back pain. She had failed at use of NSAIDs from her primary care physician. She'd failed use of opioids, failed use of muscle relaxers. It got to the point so bad that she was considered for an epidural steroid injection. She could not complete physical therapy due to the pain that was involved with it. So an epidural was tried. Epidural, what the doctor's basically trying to do is put an anti-inflammatory near the nerve root to get the swelling down. If you get the swelling down around the nerve root, obviously the pain can be reduced. When you look at this MRI, you go down, you go down, you go down. You do not have to be a neurosurgeon, you don't have to be a chiropractor, you don't have to be an orthopedic to see that there's something inherently going on with this disc. Now, the thing with low back pain is just because the disc looks bad on the MRI doesn't mean that that's the disc causing the problem. With Miss Simpson, her case was actually the disc below it. And if you can see here closely, you wouldn't even think that this is much of a bulge, but it is. It actually impedes and puts pressure on the nerve root exiting out on the left-hand side. We know that this is the chief component because the doctor who did the epidural steroid injection had tried this disc here to no avail. He then tried the disc below it and noticed an improvement with Miss Simpson's leg pain, and she did as well. However, the pain didn't completely eliminate. It was going all the way down her left leg, into the bottom of her foot, and into her calf is where it was excruciating. The epidural, she got the epidural at L4, L5, and the calf pain went away almost immediately, within the first 2 to 3 hours after the injection. However, she still had a very bad severe pain in her low back and in her hamstring. That was her third injection, and they didn't want to do another one on her. They wanted to wait. And then in doing so, while waiting, she had ran into another patient whom we had treated with a very similar condition. She came in, I looked at the MRI, went through some orthopedic and neurological testing, and agreed with the pain management doctor that it's the L4, L5 and not this guy up above. And you look at this, and this has got some modic changes in here. That's this extra whitening. The disc is completely obliterated. Again, you would think that that's the one. It wasn't. This is a commonality between chiropractors and surgeons. Our biggest thing is where the pain is coming from. All of us know that it's not always the worst disc on there that's causing the problem. So we immediately started treatment. We didn't do manipulation. If we were to do manipulation on Miss Simpson, she would not have liked us very much because all we would have created is more of an inflammatory response. We put her on non-surgical spinal decompression. Within her first 3 to 4 visits, she started noticing the leg pain retracting, which is exactly what we expect. In the first 7 to 10 visits, we want to see some considerable changes in pain. And we're used to seeing that. It is very rare we don't get considerable amount of pain relief in the first couple visits. The patients who don't, typically then we have to refer them to surgery. The good news is about 9 out of 10 patients we treat, even bad ones, they get better and they are able to avoid surgery. And I've never met a really good surgeon who didn't mind avoiding back surgery. A good surgeon only wants to operate on that 3% of people who really need it. By the way, if you're having bowel and bladder problems, if you're running a temperature, if your pain is absolutely excruciating to where you can't think, you can't function, and other things are going on, particularly temperatures and bowel and bladder, I can't say this enough. You need a surgeon probably yesterday. Get to the ER. That's not something to play around with. We've got some good surgeons in the area, both at Mary Washington Hospital and Spotsylvania Hospital, and they'll be able to notice those sort of problems and they'll be on call to get you helped out immediately. Although we do find that, thank goodness, very rare. L4, L5, L5S1, this is where we treated Miss Simpson. She's going to be on her 12th visit coming back in. Her leg pain is gone. She's basically working on her McKenzie exercises, which is a physical therapist who I greatly respect his work. We use a lot of it here in our office, particularly with these disc injuries, along with some manipulation, which Miss Simpson is now receiving on the areas above the injury, and she's doing quite well. We will continue on her strength training, and we expect a recovery for this patient. Particularly with the leg pain. She has not had to use any meds in gosh, since her second day in here. So we're really happy about this case. This is very common for us, by the way, that we see even in the worst, most excruciating cases. We're used to winning our battles with low back pain. Thank you, and check out our other videos.